Hello and welcome. My name is Dr. Henry, and in this video, we are going to explain the motor system examination. Now, we're going to start with explaining some of the basic theories you need to know. Then we'll go ahead to demonstrate the motor system examination of both the upper limb and the lower limb. Now, in the motor system examination, there are various components to the examination. The first one is the inspection. The second one is the tone. The third is the power or strength. Then the final one is the reflexes. So these are the components of the motor system examination. During motor system examination, under inspection, the first thing we're going to look out for is posture assessment, where we're going to observe the patient's resting posture, whether the patient has a normal symmetric posturing or whether the patient has some abnormal postures suggesting upper motor neuron lesions, such as hemiplegic posture in stroke, where the arms will be flexed and adducted and the leg will be extended, or decerebrate posturing or decorticate posturing when there is neurological injuries, or Parkinsonian posture, where the patient will be stooped or flexed. So, like I said, under inspection, we're going to observe the patient's resting posture, whether it is normal or abnormal. During the inspection, we also look out for contractures, because contracture might limit the range of movement of the patient. So we look out for things like contractures, scars. Then we also look out for some compensatory postures, such as guiding painful areas or supporting weak limb or asymmetrical sitting or standing. Okay. Then after that, after looking at the posture of the patient, the next thing you're going to observe is the maybe involuntary movements of the patient. So we're going to observe the movement pattern of the patient. That is resting movements that the patient can't control, such as fasciculations, where there will be fine, rapid, worm-like rippling appearance in the muscle. And one of the sites where you can observe that are the deltoids and the thigh. Then after observing for fasciculations, also observe for tremor. So check out for resting tremor and postural tremor. Then when you're done with that, also check out for maybe other involuntary movements, such as chorea, which is a dance-like random movement, or atetosis, which is a slow rhythm movement. We also have what we call myoclonus and dystonia, or tics. So check out for any abnormal movement which the patient might be displaying while the patient is resting. Okay. Then you also check out for the muscle bulk. That is the third component of inspection. Check out for muscle bulk, where you visually inspect the muscle to check if there is wasting or if there's any asymmetry. Now, if you notice any asymmetry, you can use your tape to measure, get a landmark, then measure to check if there's any asymmetry in the muscles. A difference of 1 cm actually is significant, and you have to report that. Okay, so in taking the bulk, you inspect visually, then use your tape to measure. So use the tape to measure. Sometimes for the upper limb, we use the olecranon as the landmark. Then for the lower limb, we use maybe the patella or the superior pole of the patella as a landmark. We also measure the highest calf circumference. So these are things you are going to check out for during inspection. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also share this with your friend who might need it. Now, after inspection, the next one is the muzzle tone. The muzzle tone is actually the resistance felt during passive muscle movement. That is the resistance felt when the muscles are relaxed and the joints are moving. So this reflects the resting state of muscle contraction. So we have many types of abnormal tone. So we have what we call hypertonia, where there's increased tone. Then we also have what we call hypotonia, where there's reduced tone. Now, under hypertonia, there are different types of hypertonia. We have what we call the clasp knife hypertonia, where there will be initial resistance, then there will be a certain give. We also have what we call the lead pipe rigidity, where there will be uniform resistance throughout the range. Then we also have what we call the cogwheel rigidity, where there will be resistance give. So something like a ratchet-like with superimposed tremor. So that is the cogwheel rigidity. So like I said, we have the hypertonia, which includes the clasp knife, the lead pipe, and the cogwheel rigidities. Then we also have what we call the hypotonia. We also have the paratonia, where there will be variable resistance. Now, when testing for the tone, we must make sure that the patient is relaxed. Then we're going to support the limb we are testing fully so that the patient will not contract the muscles. Then we're going to compare both sides. Then again, when we are done with tone, we'll go head over to muscle. So this is the force generated by contracting the muscle, and it is graded with the Medical Research Council scale, what we call the MRC scale. Now, the MRC scale of grading muscle grades muscle contraction from 0 to 5. So grade 0 means there's no muscle contraction or there's no visible grading. Then the grade 1 means there's flicker or traces of contraction. Then grade 2 means there's an active movement. Means that there's active movement where there's no gravity. That is movement of muscle when there's no gravity on the horizontal plane. Then grade 3 means that there's movement against gravity only. Grade 4 is movement against gravity and resistance, whereas grade 5 is normal power. That's that for power. Then for reflexes, reflex is the action performed without conscious thought as a response to a stimulus. So we have various types of reflexes. So for the neurological exam, we're going to test for the deep reflexes, which include the biceps reflex, the brachioradialis reflex, the triceps reflex. Then for the lower limb, we're going to test the knee jerk and then the ankle jerk. Then for the superficial reflex, we're going to test the plantar response. Now, we grade reflexes using this scale. 0 means that the reflex is absent. Grade 1 or 1 plus means that there is reduced reflex. Then 2 pluses means there is normal reflex. Then 3 pluses means that the reflex is hyperactive or brisk. Then 4 plus means that we have clonus, which is is repeated reflex response. Right now, we're going to go over to the exam itself. Like we always say in all our videos, during exam, every physical examination will have the pre-exam, the examination itself, and the post-exam. And the pre-exam, you greet your patient, introduce yourself, take permission from the patient, then you can perform your hand hygiene. Then at the post-exam, you thank your patient. So we have the pre-exam and the post-exam. We're going to perform the pre-exam now. Hello, good evening.
Yeah, good evening.
My name is Dr. Henry, and I'll be performing a physical examination where I'll be checking your movements and the range of motion, and that will involve me touching some parts of your body. Can I go ahead?
All right.
So we've taken the permission from the patient, we'll introduce ourselves. Then the next is perform your hand hygiene. In this video, we're going to do the motor of both the upper and the lower limb. Now, during OSCE scenarios, you might be asked to examine the motor of just the upper or motor of just the lower limb. So, but for this video, we're going to do both the upper and the lower limb. Okay, so just take note of that in case of your exams. So we're going to do motor of both the upper and the lower limb. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also, share this with your friend who might need it. Like we said, we'll start with inspection. We're checking for muscle symmetry, checking for symmetry, checking for any contractures, any scars that might limit movement. So we check both the upper, then check the lower limb. Okay, you can even go to the foot of the bed, then make sure there is symmetry. Then when you're done, the final aspect of inspection, like I said, you measure. So the landmark for the upper limb, we use the crown as a landmark. You go 15 cm up. Okay. Okay. Then you also check, use the crown as a landmark. Then you check 15 cm up. Okay. So your reading should be approximately the same for both angles, and it should be approximately the same or within 1 cm difference. Anything greater than 1 cm shows muscle wasting, and I have to report that. So with that, for the lower limb, we also do the same. Okay. There is the patella, then 20 cm above. Okay, do the same for this. So your reading should be approximately the same. Okay, anything greater than 1 cm, you report asymmetry. Okay, when we're done with inspection, the next is to check the tone. So we're going to check the tone for the upper limb first, then check the tone for the lower limb. So in checking the tone, okay, you check across the joints. Tell the patient to relax. You check across the joints. So we're going to start with the shoulder joints, then the elbow and the wrist. We check the shoulder, elbow, and wrist. Then we head over to the lower limb. Also check for the hip, the knee, and the ankle. Okay, check for tone. So in checking each of the joints, try to take the joint through all the range of movements the joints can go. So for the shoulder joints, so you can also check, okay, you can go in a circular motion because it's a ball and socket joint. Okay, then for the elbow, you check tone at the elbow joint. Okay, then you also check at the wrist. You do the same on the other hand. Okay. At the shoulder. You also check at the elbow joints. Then check at the wrist. So that is the tone for the upper limb. Then for the lower limb, okay, you do what we call log rolling of the to check the hip. So can you relax? Then you check this. Then when checking the lower limb, make sure you check the two sides together. Okay. Then for the knee, you do the knee drop. So just relax your leg. Just relax your leg. Okay. You also do that for the other leg. Relax your leg. Good. Then for the ankle, can you relax your ankle? Okay. Okay, then when you're done checking the range of motion, you check the ankle clonus where you dorsiflex. Okay. Then you wait for some time. So check for clonus. Then do the same on this side. Okay. So that is that for checking tone for both upper and lower limb. So now we're done with tone. We can see that the tone is normal in all the 4 limbs and there is no clonus elicited. Then we'll head over to the next one, which is the power. So we're going to check the power for both the upper limb and the lower limb. So we're going to check the power for both the upper limb and the lower limb. Okay, sir. Can you raise your hand? Keep your hand like this. Raise your hand. Okay, raise it up. Don't let me pull it down. Okay, that's good. Okay. Then bring your hand down. Push it down. Don't let me pull it up. Okay, don't let me pull it down. Push your arm outward. Don't let me pull it down. That's okay. Then push it down. Push it down. Don't push my hand down. Good. So you check for both abduction, extension, and flexion at the shoulder. So go to the elbow. You check for flexion and extension. So can you do your hand like this? Okay. So pull it up. Don't let me pull it down. Good. Then push my hand out. Good. So as you're doing it, you're comparing both sides to see if they are symmetric, to see if the power on both sides are the same. Then when you're done with that, then you go to the wrist. So can you please keep your hand like this? Okay. Now stretch out your hand. Keep it like this. Then pull my hand in. Okay. Good. Then push my hand out. Good. So that's how you test for the wrist. Test for the extension and flexion at the wrist. The next one is power grip. You test for the grip of the patient, which you will do with 2 fingers. So can you squeeze my 2 fingers? Squeeze it as far as you can. Good. So you check the power. That's the power grip test. Then spread your fingers. So we're going to test for finger abduction. Don't let me pull it together. Okay. Okay. Then we'll check for thumb abduction. So can you point your thumb to the ceiling? Don't let me pull it down. Good. So now we are done with checking the power for the upper limb. Let's check for power for the lower limb. We'll start with the hip, where we're going to test the flexion, the extension, the abduction, and the adduction. Okay. So lift your knee up. Just lift your knee up. No, don't lift it up too much. No, just lift it like this. Don't let me push it down. Okay. Good. So you can now keep your legs straight. Now push my hand to the bed. Don't let me pull it up. Good. Okay. So try to squeeze your knee, like push my hand to your side. Okay, push my hair, push it inside. Okay. Good. Now push my hand out. Good. With this, we'll test it for flexion, extension, abduction, and adduction at the hip. Then we'll head over to the knee, where we're going to test for extension, flexion. So now we're going to test for flexion and extension at the knee. So can you raise your leg? Okay, raise this one too. Okay, here, push me out. Okay. Then push out. Okay. Then pull me in. Good. Then pull me in. So test it for extension and flexion at the knee. Then can you keep your leg very well? Okay, so pull your leg towards you. Good. Okay, then push me out. Good. Okay. Push my hand towards each other. Push it as hard as you can. Good. Then push my hand out. Okay, so we've tested for extension, flexion, inversion and eversion at the ankle. Then, sir, can you point your toe towards the up? Don't let me push it down. Good. Push it down. Okay, so with this, we are done with power for both the upper and the lower limb. So as you can see, power is 5/5 throughout all the limbs in all the muscle groups in the upper and lower limbs bilaterally. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also, share this with your friend who might need it. So now we're going to test the reflexes. So we're going to start with the reflexes in the upper limb and then the lower limb. So for the upper limb, we're going to test for the biceps reflex, the brachioradialis reflex, and then the triceps reflex. Then for the lower limb, we're going to test for the knee jerk, the ankle jerk, and then the plantar reflex. That's for the lower limb. So for the upper limb, so we'll start with the biceps reflex. So you do it with your tendon hammer. Okay, just swing your hammer. You don't need to hit it with full force. So for the biceps reflex, okay, you start by locating the tendon. Okay, so locating the tendon, we did this fossa. Then you flex your hammer. Okay, then watch for the movement of the proximal muscle. Okay, which you are testing for the reflex, not the tendon itself. Okay, this is for biceps reflex. Then you test on this side. Okay, out. Good. Now for the triceps reflex, it's best tested sitting down. Then, okay, then position your patient's hand like this. Then locate the tendon. So when you locate the tendon, just above the olecranon. Okay. Then you test. Okay. Then do the same on this side. Locate the tendon. Then you hit. Good. So then when you're done with that, you test the brachioradialis tendon reflex. Okay. Okay, then you test. Good. So we are done with the biceps, the brachioradialis, and the triceps. So that's that for the upper limb. For the lower limb, we're going to do the knee jerk reflex. So to test for the knee jerk reflex, you either do it with the patient lying down, or you tell the patient to sit so that the leg can be free. When testing for the lower limb reflexes, you can try to distract the patient using what we call the gymnastic maneuver, where you tell the patient to clench their hand and pull apart. Okay, so can you do this? Clench and pull apart. This is to distract the patient. Why? So that you can get the perfect reflex here. Okay, so pull your hand. Okay, so then you locate the tendon, you strike. Okay, good. You do that for the other knee. Locate. Good. Now I'm going to check the ankle jerk reflex. Okay. So with that, you start by telling your patient to place your heel here. Okay. Then try to dorsiflex. Okay. Try to dorsiflex so that the tendon will be prominent. So you'll be able to locate it. Okay. Do that for the other limb. Okay. Then dorsiflex. Okay. Then you strike. Okay. So when you're done, the final reflex we're going to test is the plantar reflex. Okay, for the plantar reflex, okay, so that is the normal response. The patient should be able to plantar flex the toe. So this is normal reflex. Okay. Okay, that's the normal response. So with this, we are done with the reflexes for both the upper and the lower limb. So this brings us to the end of motor system examination. Like I said earlier, in most OSCE scenarios, you might be asked to examine the motor system of the upper limb or the motor system of the lower limb. So if you're asked for the motor system of the upper limb, just perform all the examinations, just perform the inspection, check for tone, check for power, check for reflex in the upper limb alone. If you're asked for that of the lower limb, do that for the lower limb alone. So, but in this video, we'll combine the two. Thank you very much.